Good afternoon, all the viewers of this webinar. This is Rajshekhar Joshi, Vice President, Onus Group of Hospitals. As a part of corporate social responsibility, we have been organizing webinars to educate the common public about the various health conditions. Today, we have with us Dr. Tejaswi Rao, who is a Senior Consultant Interventional Neurologist at Onus Robotic Hospitals. She'll be mainly discussing about brain pump concussion essentials. So to discuss more about this topic, I request Dr. Tejaswi Rao to take up the session. Ma'am, please. Thank you.
Thank you, sir, for this warm introduction and opportunity to teach everybody about brain bump. So today's topic is Concussion 101. So we'll be discussing broadly about what it is, how we treat it, and what should we be careful about. So think of brain as a soft jelly, basically floating inside the skull, which is protected by a fluid. That is how the brain floats within our skull. So whenever the head is hit, or we get a bump or a shake in vigorously, or we get a sudden jerk to the head, the brain basically moves and bounces inside the skull. So this can shock the brain cells, which can stretch it. It can disrupt the communication between the cells and the nerves that come from it, and may temporarily change the way the brain works, or the signal may temporarily get affected. And more importantly, concussion does not always show on an imaging, CT or MRI. It is mainly the functional deficits. Only in severe cases, we get an imaging deficit also. So sometimes people may look normal from outside. The MRI scan may look normal, but the brain functioning is disturbed. So that is why it is very important to know where it happens, when it happens, and what should we do about it. So simple examples is like sports where being hit by a ball or anything can stretch or bruise your brain inside, even though the skin over the top may look normal. Also, whiplash injury, that is nothing but when your brain is being jerked between sudden breaks or sudden accidents. Not only that the brain hits to the skull bone in the direction of the injury under force, but also there will be a bounce back. This is why there will be injury on the both sides, and the effect of injury may not be always on the side of the impact. It may be on the opposite side as well. It's called counter coup injury. What are the common causes? Like we started discussing basically accidents, two-wheelers mainly because people are more exposed to injuries and other instruments around on the road, vehicles, especially without helmets, and sports injuries starting from football, cricket, kabaddi, cycling, most of the sports, contact sports. Slips and falls, especially for elderly in the bathrooms. Domestic hits, I mean, not necessarily violence, I must say. It can be hitting the cupboard or any basement or wall corners, especially in children, and sudden jerks from a whiplash injury in a fast vehicle suddenly getting into a brake, or even in children where we vigorously shake their body or heads. So truly anybody can have a concussion starting from younger to elderly, students, working adults, even in day-to-day life, we can just go and bang on a wall or a door corner or anything. So knowing about it is almost very important. So the tricky part is symptoms may not start immediately. It may take some hours to days to start. So physical symptoms would be starting from headache, giddiness, vomitings, blurred vision or double vision of that particular eye, sensitivity to loud sounds and light, and confusion, slow response to commands, forgetting what happened, amnesia during that episode or even following that episode, lack of focus, mood behavior, sudden aggression, sudden depression, irritability, emotional sensitivity, like emotional liability, laughing more than required for a particular situation, or crying more than that, and feeling not like themselves. So a person with concussion may look normal, but the brain is working harder than usual to do simple things. That is why you feel tired and confused and overwhelmed. So that is when you should get that suspicion of something might not be right and needs evaluation. So what are the red flag signs? The symptoms which we discussed may be managed at home in some cases, but these are the red flag danger signs where immediate medical attention and hospitalization is very much important. These are repeated vomitings, increased drowsiness or sub to unconsciousness, multiple seizures, seizures that never occurred in the life before, slurring of speech, weakness of a particular side, body, hands or legs. It could be even individual arm also. One pupil larger than the other. Bleeding from the ear and the nose. It may not happen immediately. It may happen later as well. So all these are medical emergencies. Do not Google, do not wait and go to the hospital with an imaging facility of CT and MRI. So what to do immediately? First aid before you bring to the hospital. If someone, yourself or anybody around you has a had headache, so first stop all activity. No walking it off, no playing, no saying I'm okay. Make them sit down quietly and safely. Check for the responses, whether it is speech, whether it is movement of body, whether it is consciousness, understanding. Uh, don't give them water or food because in case they are having vomiting, they may choke and get aspirated. And if they're confused, better not to give it. Don't shake them to try to keep them awake because shaking will not only worsen the bleed or the injury, it may cause something new as well. So observe for the next few hours. If you notice that it's not getting better or even getting worse, it is high time to go visit a hospital. How do we evaluate when you come to the hospital? Physical examination, checking your alertness, mental activity, memory, balance, your movements, your speech, your vision. And once we come to a conclusion about particular part of the brain might have been involved, then we go for an imaging, be it BCT or MRI based on individual situation. We may take a decision of different type of imaging as well if we suspect an internal bleeding or an internal concussion. But remember, even though the scan may be normal, if the patient is having clinical deficits, we would like to treat it because it is required. It's the functioning that is impaired. So, how much time does a recovery needs? Our brain needs to reset. So, recovery is usually slow because brain cells take a lot of time to heal. This is called cognitive resting. So reduce your screen time. So rest does not mean just sitting on the bed and lying. It also means that you should decrease the load that you're giving to the brain, whether it is through ears, whether it is through your eyes or through your senses. So reduce your screen time. Avoid overstressing like video games and loud noises. Sleep well, hydrate well, eat well, and no contact sports, gym or running until doctor has given you a fitness for it. Limit your studying and office hours initially just to give a rest to your brain cell. But once it's a go from your neurologist, you may start or resume your work at least. Because it's like a battery, it needs to recharge and it takes time. And because once it is having a huge concussion, the reset time also increases. So if you return to your activities too soon, symptoms may persist for months together, and may sometimes have a lasting damage, which is what we call post-concussion syndrome. So slow and steady recovery is very crucial, and immediate first 3 weeks to 1 month would be the most important time that you should be taking care of yourself. So when do we return to your school work or sports? We go stepwise, like we discussed the light mental activity, shorter breaks and longer duration. So only after the brain can handle small situations without any symptom, we permit for physical activity. So first we permit mental activity itself. Only then we go for physical activity. Once you start playing in the minimal, moderate intensity, you should notice that if you're having no headaches or giddiness, no concentration issues, no sleep issues, not only falling asleep is difficult, but also the quality of sleep is good, and you are having no mental fogging, that is when we may think that, okay, it is time to rehab yourself into back to your normal life, but not immediately full-fledged. You can go make it gradual. So this prevents your second impact syndrome, which can be very dangerous. So how do we prevent it? So to prevent the risk of concussion, first and most important, because the accidents are high on the list, wear helmets every time, not just during long rides. Even if you're traveling for 2 kilometers, you never know what is in front. So wear helmets. Use seat belts, front and back seats. Make sure you make your children sit in the back seat. Install anti-slip mats in the bathroom to avoid slipping for the elderly. Sports training should be included with safety drills because everybody who's into particular sport, they should be aware of what kind of injuries they may get during that particular game. Avoid rough play in children, like vigorously shaking their heads and hitting, because even shaking their body will obviously shake their head as well. This itself can cause a concussion in children. And for elderly, it is better to fall-proof your house, anti-slip mats and flooring and good lighting in the nights when they wake up for bathrooms and railing for climbing stairs, whether it is be it one or two stairs as well. Prefer to have some side railings because prevention is always the best treatment. To summarize, concussion is not a small injury, it's a brain injury. It may not always look like a huge bleed, but it may have a huge functional deficits. So recognizing these symptoms early, giving it proper time to heal will only help your future brain functioning and quality of life. Otherwise, you may have a lasting damage. So brain is actually giving you only one request after a concussion: please let me heal. So when the head takes a hit, wisdom wins it by giving it care. So take care and thank you.
Thank you very much, madam, for your elaborated interaction. And of course, it was like a elaborated interaction. Moreover, it was like a informative also. Moreover, it's a very nice session. Thank you very much for your time. Thank you very much.